A ringing in the ears was not just an annoyance. In medieval Europe, it was a message from inside the body, urgent, symbolic, and alive. Imagine a sick room lit by thin candles. The doctor leans in, listening as if the sound has a name. They believe the ear heard more than sound. It caught disturbances from blood, spirits, and shifting inner balance. When the ringing rose and fell, it looked like something was moving where it shouldn't, like air trapped, humors turning sour, or a hidden blockage stirring under the skin. So treatment wasn't a single pill and done. It was a ritual of correction. Ointments and oils were rubbed around the ear and temple, meant to smooth hard, stubborn matter. Herbs were steeped into smoke, then wafted near the head, as if cleansing the passage with living fragrance. Sometimes sound itself was part of the cure. Soft tapping or chanting rhythms meant to answer the unwanted noise, coaxing the body back into order. And the strangest part? Their doctors didn't chase causes the way we do today. They interpreted the ringing like a sign, something the body was reporting in its own language. The goal was to rebalance, to drive out the problem, to restore the inner harmony that controlled hearing. Watch closely, because what begins as a simple ring could turn into smoke, scent, and carefully timed words. An entire medical worldview trying to silence a voice no one could fully explain. Why ear ringing was considered a warning sign. A ringing in the ear was once treated as a warning sent from inside the body, not a minor nuisance. In medieval thinking, the ear sat near the paths where breath and spirits traveled, so a sudden sound that no one else could hear felt like a message. The body was seen as a living instrument, and when it spoke, with a whistle or hiss, it demanded attention. Doctors watched for it, as one might watch smoke from a chimney. If the ringing came with heat in the head, a tightness in the throat, or dizziness, it was taken as a sign that something had gone out of balance. Some practitioners believed hidden moisture, thick humors, or angry vapors could press and strike the inner passages, making the ears act like sounding boards. Others interpreted it as a symptom of unseen pressure rising through the head, as if the mind itself had become a chamber echoing with trapped air. Rather than searching only for a physical cause, they read the body's signals like letters with shifting ink. The same ringing could be judged differently depending on when it appeared and how it behaved. A brief peal during exertion might be blamed on stirred fumes, while a persistent tone was treated as a steadier, darker trouble. Pain, sleep loss, and sudden changes of mood were treated as part of the same statement, not separate problems. Remedies followed that logic, aiming to calm the message in the body's routes of breath and heat. Oils and ointments were used with care, sometimes gently warmed first, as if soothing could persuade the inner passages to stop clanging. Herbs were prepared for fumes and steams, and smoke carried through rituals that treated the ears like gates needing clearing. Sound was also treated as medicine in its own way. Chants, rhythmic recitations, and calming speech were performed to settle the whole person, since the ringing was believed to be tied to the state of the heart and mind. Even the timing of treatment carried weight. If the ringing was linked to strong emotions, the response might shift toward quieting the spirit as much as clearing the body. Practitioners might press the skin near the ear or guide the flow of attention with massage and measured breath, because soothing the nerves of the head was thought to change what the ear reported. In that world, a ringing sound was not dismissed. Ear noise, described in old records as a ringing, buzzing, or roaring inside the head, was often treated as a message from within the body rather than a problem of the ear itself. Physicians looked for causes in the humors and the hidden motions of spirits in the blood and nerves, so the treatment aimed to change what the body believed was happening inside. A steady clamor meant the internal balance had shifted, and the cure had to do more than soothe. It had to quiet the signals the body was sending. Many doctors swore by a hands-on approach, warm oils applied to the ear, sometimes mixed with herbs, to soften passages and calm harsh internal heat. The room would smell of warmed substances, thick and amber, with a cloth set ready to catch drips. Some remedies used oils steeped with aromatic plants, because scent was treated like a kind of medicine for the airways and the head. A practitioner might tilt the patient's head, then dab carefully, as if guiding sound away from the inner turmoil. The goal was not to numb, but to restore a proper flow through the body's secret channels. Smoke carried a different kind of authority in these treatments. Physicians and healers used pipes, small braziers, or bundles of herbs to send fragrant smoke toward the ears, believing it could draw out harmful influences and settle rattling disturbances. The patient would sit still while smoke curled close, and the healer watched for signs of comfort or release. Heat, scent, and controlled airflow were treated as one bundle of forces, each meant to steer the body back into order. Even when the method seems strange now, the logic was clear to them. If the noise came from inside agitation, then disciplined external movement could calm it. Sound rituals also had a place, because noise was considered something that could be answered. Some practitioners used specific rhythms or gentle tones, as if the ear could be trained the way a bell learns to stop vibrating. Others favored silence between bursts of sound, giving the body room to settle. These approaches were less about diagnosing a malfunction and more about persuading the body to stop echoing its own alarm. In a dim room with murmuring attendants and careful breathing, the practice felt like negotiation with an unseen engine behind the ear. Another surprising strand was the use of cooling measures to counter overheated origins of ringing. Healers might prescribe cooling drinks and herb infusions, then pair them with topical applications meant to draw heat down and away from sensitive inner parts. The patient could be wrapped to keep warmth from escalating, while certain strong flavors were avoided to prevent the body from firing again. Doctors described the internal noise as if it traveled with restless fluids, so calming the whole system mattered as much as treating the ear. When the ringing eased, it was taken as proof that the body's interpretation of its own state had been corrected. Did these treatments actually help patients? Ringing in the ears was once treated as a message from inside the body, not as a problem with a simple sound problem. Doctors listened for patterns in the complaint the way they listened for symptoms of fever: bright, sharp, constant, or changing with body heat. If the ringing rose after worry, then the mind was blamed. If it came after illness, the body's humors were suspected of imbalance. That interpretation shaped everything that followed. Remedies aimed to correct the body's state, not to stop a nerve signal. Some healers treated ear trouble with oils, carefully warmed and applied near the ear or introduced by small measures. They used herbs that were believed to draw out cold, calm sharpness, or seal weakness, depending on how the symptoms were described. The logic was direct and tactile. If a substance softened the body, the strange sound should soften too. A practitioner might massage the area around the ear with scented oil, then wrap it for containment, as if the body needed a steady, controlled environment to settle. Smoke rituals also appeared in ear care, because smoke was thought to carry healing qualities and to drive away troubling influences. A hearth could become part of the treatment, with herbs burned so the smoke gathered near the face and ears. The healer might speak prayers while tending the smoke, tying the physical act to a moral and spiritual correction. People often reported relief when attention, expectation, and repeated calming actions were strong. That matters because the ringing itself can quiet when the body relaxes, when breathing slows, and when fear eases. Sound rituals could be just as physical as the smoke. Some traditions used chants, rhythmic tapping, or controlled external noises to balance the body's internal alarms. The goal was not to drown the ear with sound, but to persuade the inner disturbance to align with a steadier pattern. In a world where invisible internal causes were treated as if they could be coaxed, rhythmic hearing felt like a negotiation rather than a distraction. Patients would watch the healer's timing and tone, and then wait for the ringing to shift. Did these treatments actually help patients? Relief was possible, but it often came from the way the remedies changed the whole experience. Warmth, pressure, soothing touch, calm breathing, and a strong belief that the body could be set right. A person who feels cared for, protected, and guided through a ritual may report improvement even if the underlying cause remains. Oils could reduce dryness or irritation and make the ear feel less sensitive. Smoke and external sound could alter attention and stress, which are known to influence how loud internal sensations feel. Still, the limits were real. Many causes of ringing are not something oils, herbs, or prayers can undo, especially when the problem is tied to damage, aging, or persistent internal processes. Treatments could also irritate the area if used carelessly, and some people might delay help when symptoms needed a different kind of care. The historical focus on restoring balance could fit some cases and miss others, which is why outcomes varied widely from household to household. What looks like medicine was often a blend of observation, symbolism, and practical soothing, effective sometimes, unreliable often, and always shaped by the worldview of the time. In the old world, a ringing ear was not a simple annoyance. It was a message, spoken inside the body, about what had gone wrong beneath the skin. Doctors watched the sound the way sailors read clouds. A thin tone meant one kind of imbalance. A loud roar meant another. They listened to timing too, what you heard after meals, after sleep, after travel. They believed the ear acted like a doorway. Something inside was pushing, draining, warming, or cooling the air of the body. If the breath inside moved the wrong way, the ear would sing. So treatment became a visible ritual. The hands came first, gentle and certain. Warm oils were rubbed near the ear and temple, scented with herbs said to calm heat and ease tightness. Smoke drifted from burning leaves and resins, not as a cure from chemistry, but as a cleansing breath that chased stubborn forces outward. Sometimes a cloth soaked in herbal oils was placed close to the opening, held there like a soft seal. Sound mattered, too. Small chants and spoken prayers filled the room. The goal wasn't entertainment. It was to answer the ringing, align the body's hidden rhythm with a steadier one. And the most surprising part? They rarely treated the ear as the only problem. The signal in the ear was treated like a warning from the whole system, something affecting nerves, humors, and balance across the body. You may still hear that familiar buzz today and feel alone with it. But if you watch the old remedies with open eyes, you feel the shared human instinct, the urge to explain, to soothe, to restore order when the body speaks strangely. If this ending pulled you in, keep going. In the next video, we'll follow the stories behind other body messages people once believed. Then watch how those beliefs collided with new ways of seeing the world.